Welcome to Relational Psychotherapy Clinic. My name is Dr Monika Wieliczko and I'm a chartered clinical psychologist in private practice. My clinic is based in Bromley and I offer psychological therapy and psychological consultation to individuals and couples, adults and young people in Southeast London. I would like to tell you a little bit about myself today, hoping that it might help you decide whether now is the right time to think about therapy, whether in fact you might benefit from it, how that might help you. And if that's the case, I would welcome you getting in touch and discussing things further, whether that would be through email or a phone call. So just to start with, what is psychological therapy? Well, I think in short, psychological therapy is a relational process. It's something that aims at increasing your self-awareness, increasing your knowledge of yourself, your thoughts, your feelings, your understanding your behaviors, what's driving certain patterns in your life. So really kind of getting in touch with yourself. And you can do that through developing a relationship, a therapeutic alliance, therapeutic relationship with a trained professional who can help you get on that journey of self-discovery. And it usually is quite a challenging, quite a demanding process that requires a longer period of time. So it's important to know that you can commit to something that can unfold over a number of months and years in many cases. And the important part is your ability your willingness to understand yourself better. That can provide some valuable insights, some valuable information that might help you develop internally. And what do I mean by that? Because it might sound a little bit fuzzy, really, but this internal development is about integration. So it's about integrating different parts of yourselves. Sometimes those parts might be in conflict with each other. And if that's the case, that might manifest itself as a range of symptoms. Sometimes it could be seen as depression or anxiety. Sometimes it could be behaviors. It could be difficulty in relationships, getting angry, getting frustrated with people, having difficulties interacting with others, or generally speaking, having certain addictions or difficult behaviors that might be negatively impacting on your ability to have a fulfilling life. So there's a range of things really that therapy can help you with. In fact, I think it's not really about those symptoms, but what's driving them. And that's what I would usually encourage my patient to look into. What's behind the closed door, if you like. And I think that process requires a certain level of interest, curiosity. So I would encourage you to be curious, to keep an open mind, to observe yourself. And as a result, that can lead to a greater sense of integration. So instead of those conflicts being particularly difficult, I think you might notice them getting less and less challenging. So you might find yourself through therapy discovering that things that normally felt particularly hard to think about or to do, or things you've been avoiding doing, they might become a bit more available to you. And as I said at the beginning, this usually involves a longer term process. And that can be sometimes frustrating, and sometimes during this process various feelings and reactions might be triggered within the relationship, and this is something that we would look into together to help you make sense of those, to help you understand where they come from, and to know what to do with them, how to react differently. So sometimes it's about learning a different way of being, a different way of experiencing yourself and others. So therapy can be an extremely rewarding and transformative process, and it's the beauty of it is that you never quite know what's going to wait for you at the other end. Often people come to therapy having a certain ideas, perhaps certain expectations, what they would like to get from it. Some of them are achievable, some of them are not, and that's also part of the process. And often what you find out as the process unfolds is that your perception of your difficulties is changing, and also your perception of yourself and your relationship with your problems are changing. And one of the things that is particularly rewarding in my work, and I do feel like I'm particularly privileged to work with people and to witness their process of transforming their lives, the process of growing and developing their self-awareness, how their relationships improve, is this ability to observe how vulnerability and ability to open up to another person, here to your therapist, helps you transform those skills, those experiences, generate them to other situations and other relationships. So you might find yourself creating healthier relationships outside, improving your relationships with people that you love, and if you're having difficulties creating those relationships, then perhaps the ability to do that might improve over time. Another thing that people often come to see me for is are difficulties related to certain traumas. And what I mean by trauma is an experience which felt particularly threatening, particularly frightening. It could be something you've experienced in childhood, but it also could be something recent, or there could be multiple events. And often the way I see it is that actually life is full of those experiences. And how we deal with them, how we integrate them, how we work through them is the basis of how well we function, how well adjusted we are to future adverse experiences. So in a way you can think about therapy as a form of investment into your future. So it doesn't just improve your past experiences, it doesn't improve your ability to cope with the past experiences. You know, we can't change the past, but we can't change the way you experience yourself as a result of those experiences. And we can also help you grow a thicker emotional skin, so this ability to experience and deal with difficult, challenging circumstances. So this is in short how therapy can be helpful. Another thing to think about would be whether now is the right time to do this. So one of the few things you need to ask yourselves would be around your ability to commit to this process. And you might not know this straight away, And usually this is something that could be potentially explored during the initial consultation, and this is the process during which we would talk a little bit about what therapy, experience of therapy might be for you, what you would like to achieve from it. We would think a little bit about your past relationships, your past experiences, and your current life, what's going on in your life, what you've got in your life, and get a sense of what kind of difficulties you're experiencing in life. And there can be a range of things, really. And that gives us a sense of what we might want to work on together. And as a result, prepare you to make a transition or make a decision whether this is something you would be interested in. The time and commitment is key in this process. There's no a clear cut to emotional growth, emotional development, maturity. It takes time, and it can be uncomfortable, but it also can be extremely rewarding. And most people, I think, who've been through therapy process would agree that it's something one of the best gifts you can give yourself is this attention, time and commitment to yourself. So if that sounds like something you think you would be interested in or would like to think a little bit more about, I think the initial contact, initial consultation can give you a sense of whether now is the right time, what kind of therapy you might benefit from. There is a whole range of therapeutic approaches that have certain indications for certain difficulties, but also for whether that fit with who you are, how you prefer to work, but also to think whether the person you're coming to see, whether this is a good match for you. So it really is a transaction, is a certain process that has to be agreed upon. It might take a few times, it might take a while before you settle for something, before you make a decision that you want to commit to something with a particular therapist. Usually by attending the initial consultation, you might get a sense, you might get recommendations, what might be helpful for you at this stage. So even though you might have some doubts whether now is the right time, whether you're willing to commit to these things, it may still be worth giving it a try to perhaps give yourself a chance to explore those doubts, to understand what might be stopping you from exploring yourself. So I hope this has been helpful in some ways.